Hi there, folks. Thanks so much for joining us. We're going to get started here in just a moment. Okay, my friends, we are going to go ahead and get started. I'm sure that more folks are going to be joining us, but we have so much to talk about, not a huge amount of time to talk about it. So I am going to go ahead and start with some opening remarks and then open it up to our panelists who are going to have some of their own opening remarks, and then we'll open it up to some questions later on. You'll notice that if you're joining us as an attendee, you're not going to be able to see yourself, and your comments, what you do in the chat box will be visible to us here as panelists. So if you'd like to introduce yourself to the panelists, now is a good time to do so. All right. Welcome, and thank you for joining today's panel. Today's important topic is, where can I turn for reliable news? A question that we know is on many of your minds. We have a lot to talk about and not as much time as I'm sure we'd all like, so I'll be brief with our opening remarks and then open it up to our panelists. My name is Max Colley, and I'm the Program Manager for Learning Philosophy and Evaluation at the Museum of Life and Science in Durham, North Carolina. This webinar is brought to you and made possible by the Museum of Life and Science, as we believe that responsible science dissemination and communication to our communities is extremely critical in this unusual time. I'd also like to thank our friends at Duke Global Health Institute and Innovations in Healthcare for their ongoing help with this series. I'd like to thank all of our esteemed and illustrious panelists for taking the time to join us and to share their expertise with us today. I'll let all of them do a better job of introducing themselves when they have a chance to make some opening remarks, but our order will be as follows. First, we'll hear from Dr. Sean Knipe, Associate Professor of Adult Health, Primary Care, Public Health and Community Practice, Women's Health at the UNC School of Nursing, Dr. Megan Manfra, Associate Professor at the North Carolina State University College of Education, Mary Brophy Marcus, Senior Communications Specialist at the Duke Global Health Institute, Anita Rao, Managing Editor and regular host of The State of Things on North Carolina Public Radio WUNC, and Tom Linden, MD, Glaxo Wellcome Distinguished Professor of Medical Journalism at the UNC Hussman School of Journalism and Media. Our format today will be as follows. We'll give some time for each of our panelists to wrestle with our central question of, where can I turn for reliable news? And then move on to answering some questions that many of you were gracious enough to give us over this past week. Time permitting, we may also be able to answer some questions from the chat box and in the Q&A. At the end, each of our panelists will make a brief closing remark before we convene. Just a few more notes before we get underway. I want everyone to keep in mind that there are likely children present or watching in the background, as we're all figuring out how to live our family and work lives in the same space. To that end, we're maintaining a pretty strict code of behavioral conduct for this panel, and Zoom's functionality allows us to mute or even remove people from the webinar if they're acting in a way that is inappropriate or inconsiderate for people watching at home with their children around. We don't want to, and frankly don't anticipate having to use that functionality. But this is a reminder that now is a time for compassion, consideration, and kindness to one another as we navigate these trying times together. We have, however, muted participants and will keep them muted, and taken away screen share capability as well as a precaution. It is okay to disagree with one another, and we also know that there are likely questions that you have that may not be answerable even for our illustrious panel or currently by the scientific community at large. If you have questions regarding you or your family's health, we ask that you consult with a medical health professional. If you have further questions that aren't answered, I'll drop a link into the chat box in just a few minutes to the Federation of American Scientists Ask a Scientist tool and the CDC's page about COVID-19, both of which are useful tools. Finally, we ask for and appreciate your patience and understanding, as we are all learning as well about COVID-19, about parenting, about hosting webinars online. And to that end, and without further ado, I'd like to introduce our very first panelist, my friend, Dr. Sean Knipe.
Thank you, Max. I don't think I'm muted. Make sure I'm not. I'm not. So welcome, everyone, and I'm very happy to be here with you today. I am currently serving as the American Public Health Association Public Health Nursing Section Chair, which has put me in a very busy state given the pandemic and sort of looking after all of the public health nurses nationwide this year. So I feel like many of you probably like I'm consuming news bit after news bit at a pace that I cannot even keep up with. As we're talking to our lobbyists with around funding, what are we trying to strategically think about what we need right now to respond to the pandemic, and I'm trying to digest all the information that I can get to make some informed recommendations in that way. So if you're feeling like you're struggling, I think many of us here are with you on that, I would say. I'm not going to talk as much about, here's a list of the credible news sources or places for you to get your news. I do have a list like that in my head, but I'm sure that other folks will be able to talk about that. I think one of my main messages today is really for all of us to just sort of contextualize where we are, where we're sitting in this place and time, and how people kind of respond to that. As a nurse, that's what I do all the time is, try to help people adapt to their situations and their health threats and things like that. I think right now we're living in a time of a lot of uncertainty. And when we're living in a time like that, people get really afraid and fearful and want certainty and absolute answers so that they can feel like some part of their world is stable. And I think sometimes when scientists don't have those certain answers readily available, it can be easy to think, well, they don't, nobody knows, right? Nothing's credible. But their science really is about building information kind of bit by bit. And I think what I would say is to exercise patience and understand that we will all be uncertain about various things as we go forward in the next several months. But it doesn't mean that there are no facts that we can use to kind of guide our way forward. Sometimes they're hard to decipher. Many times they're temporary until the next study shows something different that maybe was a better study or more rigorously done. So I think my advice is to, again, be patient. Think about how you are responding to and reacting to sort of the very human need of wanting some certainty when it's difficult to provide that, even from the top scientists in the country.
Sean, thanks so much. Our next panelist is Dr. Megan Manfra. Megan, go for it.
Hey there, everyone. I'm an associate professor in the College of Education here at NC State, and I have a few resources that I wanted to share. So for me in particular, what I'm interested in is the integration of technology into classrooms. And so I'm particularly interested in thinking about how we help our young people navigate this complex information age. And so when we work with students, we focus on media literacy as an essential skill And I emphasize Skil because I think this is something that needs to be taught and also supported. So although we sometimes feel like our youth today, our digital natives, they don't necessarily know the best strategies for navigating online content and sorting out what's credible from non-credible sources. So I'm going to kind of focus on two particular things, the context of fake news and misinformation today, and then what we know about teens and media use. So one of the things that makes this even more complex is there's a real continuum of fake news, of course, between outright hoaxes or lies to misrepresentation. So I have two examples here for you. And these are from the News Literacy Project's weekly summary called The Sift, which I highly recommend, and I think we have the link available for you. So on the left-hand side is the type of false reporting you may have seen where there's kind of cures for COVID. And then on the right-hand side is more of a misrepresentation. In this particular case, there was a correction to the news article, but by the time this was posted or reposted by someone, it had gone viral. And so it was difficult for, it had gotten away from the source. And so the misinformation had already been spread. And so I think the question that's raised is like, well, where is this context coming from? Why are we in this situation? Certainly fake news became part of our lexicon after the 2016 presidential election. I think it was the word of the year by many dictionaries the year after. And it's in part because of these three things going on. One is commercialization. So it's really important for all of us and our students to understand that people are producing this because they're seeking revenue. So, and in particular, they may post provocative headlines, or we've heard clickbait, to drive users to their sites. The other important aspect here is that it amplifies often minority opinions and makes those views seem more prolific and may normalize sort of more radical views. So this is where we see growing conspiracy theories, for instance, around the COVID crisis. And then finally, the third point here is that often what we're seeing online is polarizing. You take all of these into context, when you want to drive people to your site, you often will use things that may either cause fear or drive someone, represent something that they already agree with. So we have a lot of confirmation bias that we talk about with our students and some strategies for dealing with this. So at the same time, so we have this really complex sort of ecology of fake news and misinformation online, but we know that teens are almost primarily online and using social media as their main source of information. So here's some research from the Pew Institute in which teens report that 45% say they're online almost constantly. And they have sort of a mixed picture about the social media's effect on their lives. So there's a positive effects that they report, but also some negative effects. And so as educators and parents, it's important for us to help them navigate social media in general, the relationship to it, as well as this complex landscape of fake news. And so sort of one final point here about teens and their media use is that they're particularly prone to this because of the developmental age as adolescents. A great book called Popular that I recommend describes the ways in which the brain chemistry really supports teens using social media in particular. So some of the skills, so going back to the idea that media literacy is a learned behavior, what we suggest is that we first understand bias in reporting, particularly confirmation bias. So those things that tend to support that which we believe in, be extra careful about that. Also, one great strategy for navigating this is to read laterally. So read multiple sources about the same topic. Visit the About Us page I recommend, for example, that you look for people who post their journalism ethics statements, for example, on their site, and understand where these sources are coming from. Some of the old strategies we used to use, like if the website ended with .com or .org, those things don't really help us navigate whether it's credible or not. This is increasingly very sophisticated online. Obviously, think before you post, maybe even use a couple of hours or maybe a day before you repost something, before you, and certainly make sure you check for credibility. And then I included this here to encourage positive aspects of social media and technology. I don't think we're in a situation where we need to ask teens or any of us really to disconnect. However, we could encourage our students and our children to use the beneficial side of social media to their advantage. For instance, to connect during this really troubling time, perhaps to have credibility partners, classmates that they work with on their each day to complete their schoolwork, etc. But then, of course, to take a break and unplug. So I think I noticed that the CDC has even suggested that we shouldn't be watching news almost totally. So if you have the TV, for instance, in a common area in the home, making sure that it's not always on and not always showing the news.
Megan, thanks so much. Our next panelist is Mary.
Hello. I'm speaking from a perspective of up until last fall, I was a news journalist for my whole career, almost 20 years. And I was with CBS News and with USA Today, and I covered science and medicine. And so I kind of come at this from someone who's been a reporter and an editor and a mom of teens. And I guess for starters, I would say I look at information gathering, especially right now during this pandemic, as sort of a funnel. We have the whole world to draw from, and where I start as a storyteller and at the Duke Global Health Institute, my job now is to tell stories about what our researchers are doing, what our students are doing, and I manage our social media. And so there's a lot of forms of storytelling that I do. And so the way I look for good, credible information is I start with my Duke scientists now, my colleagues in medicine who are practicing clinical medicine and research. So I'm talking to people who are in labs and taking nasal swabs. And then I'm also talking to people who are seeing patients, as well as faculty, medical and science faculty who are teaching undergraduate and higher education audiences. So they're my first line of information. Then I stretched my tentacles out to other medical centers. We have a network of colleagues and friends at other universities and medical centers around the country. So Harvard, University of Pennsylvania, UCLA, the Mayo Clinic. These are all really credible resources. The University of Washington in Seattle, University of New York, Langone Medical Center. They all are associated with big, credible medical schools and groups of scientists who are actively involved in COVID research right now. And all of their websites are run by teams of excellent science communicators, and they're posting stories and their science weekly and daily, and they're great resources, I think, for parents. You can also go to their, if you have younger kids, you can go to their hospitals for children out in Seattle. Seattle Children's is a great medical center too. So you can find stories for families, stories about prevention, stories about how to deal if you have someone in the family who's sick and you don't know what to do. They're a good place to go. I'm just scrolling down my list. So after that, I'm a news junkie, and I read the news every day, multiple times a day. I don't think that's great for people who aren't in this profession, but and And I even take breaks occasionally on the weekend. But some of the news sources I really trust, having been a reporter and an editor at CBS, I trust them. They have two very good doctors if you're looking for Twitter feeds to follow or news stories to find. Dr. David Agus and Dr. John LaPook are longtime physicians who both still have clinical practices, but they also are right on top of the news. And one's in LA and one's in New York City, and these are, you know, epicenters of where coronavirus is, you know, affecting a lot of people. So I think they know what's going on. I read the New York Times. They've made they usually have a paywall, but they've made all of their coronavirus information free to the public for now. If you're interested in policy and healthcare, Politico has an excellent group of healthcare reporters and editors. I really enjoy Dan Diamond. He's got a podcast every week, and there's an editor there, Joanne Kennan, who's very good, and she's on Twitter. They're both on Twitter. I do recommend social media, but you do have to be very careful and find people who are good. Let me see what else. And then there are the health agencies, the World Health Organization, the CDC. I think it's important to look at the leading health agencies globally too, so we don't just get a America-centric perspective. You know, I think it's important that we really pay attention to what's going on in multiple parts of the world. You know, what's happening in Africa, low-income countries, middle-income countries, just to get that sort of broad perspective. Another great resource are the very big, reputable nonprofit organizations. And I know the speaker before me was just talking about how you do have to be careful, but there are some that have been around a while and you can trust. If you have someone in your family with diabetes, for example, you could go to the American Diabetes Association. Same with heart disease, the American Heart Association. They both have excellent sections now on coronavirus. And, you know, if you have type 1 or type 2 diabetes, you can go and kind of get their perspective on what to do and the special situations that might arise for you with your chronic health condition. And then, of course, there's local health resources. So I'm always checking in on my county health team's website just to kind of see what the daily stats are on, you know, how many people in my community have it, or the places in my community I need to avoid. Like I know here where I am in Virginia, we had a nursing home that had it recently, had a couple COVID cases, and it's someplace where I walked by every day, and I've just changed my path, and I you know, go a different way now. It may sound silly, but it's just, you know, one of those things that gives me peace of mind. And I guess my final recommendation would be with fake news. How do I ferret out whether something's fake news or not? I get that question a lot actually from friends right now who just don't know what resources to draw on. And I would say make sure whatever you're reading or listening to uses credible sources, physicians from credible medical centers. Make sure they're sourcing all of their facts, maybe linking back to medical studies and in journals. Make sure it's not just a reporter isn't using one source. You know, a story with multiple sources is always something to look for. So you're seeing, you know, getting a well-rounded, well-reported piece. So I guess that's it for me.
Mary, thanks so much. Our next panelist is Anita. Anita, you ready?
Ready. Hey everyone, my name is Anita Rao, and I am the managing editor of The State of Things on North Carolina Public Radio, WUNC. And I am very much in the midst of trying to figure out how to navigate this myself, as are all of my colleagues. We're very much in the daily news cycle and trying to figure out what's a balanced way to approach integrating, getting the coverage we need without going absolutely insane. So I have a couple of steps for you all to follow to kind of guide your news consumption. And the first is do not be this guy, which is kind of who I felt like I am the past few weeks, which is someone who is constantly getting all the push notifications from every news organization they follow, who's constantly like going between websites, catching all of the latest headlines. I find when I'm in this state, I'm not actually integrating and absorbing information. I'm in this kind of fight or flight zone. And we know when we're in that space physiologically, we can't actually, you know, absorb and interpret and get the information we need to make reasonable decisions for ourselves and our families. So step one, try to not be in this headspace, and I'll give you some alternatives to doing so. I think creating a news diet that works for you is really important, and that looks different for everyone based on your education level, based on your circumstances, based on how your day is structured. But some things I recommend that I think kind of generally work for most people is finding a few trusted news sources and finding ways to check in with them in a way that works for you. So whether that's, you know, I'm going to do it at lunch, it's the middle of my day, I'll have the morning news, I'll have enough to kind of get through my day, and I'll check in again tomorrow. Or is that at the beginning of your work day, then you don't look at news for a while and then check in at the end of your work day. Find ways to integrate news into your life that work for you, but make sure you're doing it in a way that's not constant consumption all of the time, because especially right now, that's not going to really serve any of us. So in terms of finding your trusted news sources, I would really recommend you go local for one of them. Our local news throughout North Carolina, people are really hustling to find ways to contextualize what's happening in our state, the data in our state, the research from our hospitals, the latest modeling relevant to our state and how things are going to be in flux. I have some specific recommendations I'll give in a second, but try to make sure that one of your trusted news sources is local, because I think it's really important right now to think about, you know, how is this affecting the people right outside your door in your own community. Prioritize sources that focus on context. So when you are reading numbers and you're just looking at kind of ticks up of deaths, to make sure you're looking at those numbers from sources that are contextualizing that data. How does that compare to deaths in other states, in other countries? What are the denominators of the fractions that they're giving? I've seen some news outlets, you know, that they'll kind of give you headline blowing numbers, but they won't put that data in context, and that doesn't really serve us. So make sure you're looking at sources that are asking the questions, what are these models based on? What are the assumptions in the data collection? And make sure that that's really present in all the sources you're looking at. Balancing the science with everyday life. So in our everyday lives, we do have, you know, we have health, we have our bodies, we have disease, but then we have our communities, we have our friends, we have our networks, we have our artists, we have our restaurants. So try to find ways to engage with the news right now that really reflect your entire environment. So that could be, you know, making sure that you're looking at, you know, really practical coverage about, you know, how to go to the grocery store, how to stay safe, as well as how's your community banding together? What are ways that you can kind of lean in and support your neighbors? So try to really balance the science with everyday life. Be intentional about how and in what ways you're checking in with things. I think newsletters and podcasts are both really good ways to consume news because they have a really clear beginning, middle, and end. When you get to the end of that newsletter, you're done. You can turn it off. You can press pause. New York Times and the Washington Post both have really great coronavirus newsletters right now. There are a couple of great podcasts. NPR has started one that's COVID specific. The Daily I always recommend for kind of a good deep dive on the news. And then if you are more of a TV news person than a radio or a print news person, having some awareness and literacy about how 24-hour news cycles work, I think is really important. So to keep a 24-hour news cycle going, you have to have headlines that are sexy, that are going to keep drawing people in. But really, every 30 to 40 minutes, the news is not changing that drastically. So if you watch cable news and you've watched it for 30 to 40 minutes, you can really stop and pause because you've gotten most of the news you need in that period. Check back again 5 or 6 hours later in that 30 to 40 minute chunk, and you're going to get most of what you need. You'll start to notice after that 40-minute mark, stories really start to repeat because there's not really quite enough news to fill that constant feed. And then put things away. Put your phone away, put it on airplane mode, find ways to disconnect at a certain point. Step 3 are my local news recommendations. In terms of podcasts, I mentioned there are a couple of great podcasts. WUNC has started a new podcast called Tested that is all about how North Carolina is dealing with COVID. I highly recommend it. There's some great nonprofit news organizations in North Carolina that have really devoted their attention right now to focusing on COVID stories in North Carolina and are doing a really great job. North Carolina Health News is one of them. They're really distilling public health recommendations and case counts while asking questions that are really relevant to North Carolina residents. The News and Observer has dropped the paywall for their COVID coverage and are doing a really nice job of kind of having this rolling feed of relevant updates. They have some really great investigative coverage of what's going on inside our state's prisons, inside nursing homes, and great digital coverage of developments all around the state. And then Carolina Public Press is an investigative reporting outlet based in Western North Carolina. But they've done something really neat and deployed a lot of their journalists with investigative chops to support news coverage in other parts of the state. So they've deployed them to help out local news organizations in really rural areas that maybe don't have the bandwidth right now to devote a lot of intensive coverage to COVID. They've been intentional about deploying their reporters out and are really calling that information nicely on their website. So be a smart consumer. People have talked about this a lot today, but I think kind of the first thing to do is ask yourself a couple of questions. When you see a Facebook post going around about hot water being a cure to COVID-19, ask yourself, does this make sense? It doesn't. So, kind of ask yourself that first basic question. That should be your first automatic response. Does this make sense? Is this logical? Then who stands to gain from this? There are a variety of reasons why fake news explodes at particular times like this, and it's because there are things that people can stand to gain financially. So ask yourself that question, and then give yourself a minute to kind of process and contextualize. I know for me, when I'm looking at my Twitter feed, I see things from my friends equally as much as I see things from news outlets. On Facebook, their algorithms are done in such a way you actually see much more from friends and family than you do from pages or organizations that you follow. So make sure you're contextualizing, who is this news actually from, who posted this, and let me process and think about that for a second. And then check your source. As people said earlier today, there are a lot of great ways to do that. Go to their about page, read their about information, read their code of conduct, read how they're funded. Are they nonprofit? Are they funded by one side or the other? Do they post things about their history, their mission, their ethics? Look at timestamps. When was this article published? Right now, the news is changing so quickly. So if it's 3 weeks old, maybe it's not going to be the most relevant information you need right now. And then, is this information a primary source? Is this scientists reporting on their own research, or is this a journalist contextualizing research other scientists have done? Corroborate your information. Two, there are lots of organizations out there doing a nice job of kind of fact checking and debunking myths. PolitiFact is one of them. They have a whole coronavirus page right now where they are debunking both things that are popping up a lot on Twitter and Facebook, as well as other kind of claims in the news. So don't be that first guy, but be this kid. And this kid to me is someone who is intentional, who is consuming the news in a balanced way, who's being intentional when he's consuming it, and then he's going to put down his paper and he's going to move on at a certain point. And really think about, creating a news diet that works for him, that has a few reliable sources. He checks in with them intentionally, and then he lets it go. And this is a time when, so many industries are really struggling, and local news is one of them. And so I'd really encourage you all to kind of find ways to support them through your readership, through whatever way you can, because I feel like local journalism is really important right now, kind of contextualizing this big national story.
Anita, thanks so much. Our last panelist is Tom. Tom, go for it, pal. Uh-oh, Tom, you are still muted, my friend.
Okay, here I am. I will second what Anita said about supporting your local news operations, WNC Radio, the North Carolina Health News that's published and edited by Rose Hoban, a former WNC health reporter, WNC TV or UNC TV, North Carolina Public Media. These are all important news sources. And then, of course, the NNO, the Charlotte Observer, and your local community newspapers are really important to support. I think the challenge here is that it's not just news or media literacy, it's also science literacy. And together, taking those two together, they present a challenge to parents and the public at large. Here are some recommendations, some of which you've probably already heard. In general, go to primary and credible sources like the Centers for Disease Control and Prevention, the CDC, or the National Institutes of Health, the NIH. They have pages that are chock full of really excellent information that would be of great use to parents or anybody for that matter. Rely on people whose mission and career is to promote scientific knowledge or scientific literacy. Avoid news sources that put out conspiracy theories or seek simple explanations or solutions for complex problems. Case in point, unfortunately, our president promoting hydroxychloroquine as a reputable treatment for COVID-19, when in fact the first NIH clinical trial just began a day ago at Vanderbilt University Medical Center. Hydroxychloroquine is an anti-malarial drug. It is not proven efficacious, effective, or even safe in patients with COVID-19. It's an experimental treatment, and experimental treatments take time to prove not only that they're effective, but that they're safe. And so clinical trial takes often many months. It could be a year or more before we can be confident that hydroxychloroquine works, or we'll know for sure that it doesn't work for COVID-19. But avoid these simple solutions to complex problems that politicians who have a podium may be promoting for their own personal and political gain. Just because someone is in a position of power does not necessarily mean that they know what they're talking about or that they even have your best interests at heart. When you read a story, question the truth of an assertion or statement. Ask yourself, what is the source of that information? What's the primary source? And by primary source, I mean the research study that may have been the basis or the seed for the statement. Is the person speaking from a career as a clinician, a healthcare provider? Are they speaking from their own personal fund of knowledge? Or is this someone who's just spouting what they may have heard on social media? Recognize also that doctors at this time are operating without a lot of verifiable information themselves in treating COVID-19. There is, in fact, no treatment for COVID-19 other than supportive treatment, which means keeping fever down, providing oxygen or a ventilator if a person can't breathe. This is all supportive treatment. They are not treating the virus itself. At this point, we do not have any drug that we know treats the virus. As others have said, stop reading the same material over and over again. That's when you know to put the media down. And as I said before, be aware of people who have an ideological agenda, bad players, or people who simply seek to profit from the pandemic, or self-proclaimed experts. For sources of information, I'll repeat some that others have said. As I mentioned earlier, CDC and NIH are the go-to places. Johns Hopkins Medical Center has an excellent site that's tracking the number of cases and positive tests for the novel coronavirus worldwide. Scientific American, I mentioned the local news sources. National sources, PBS NewsHour is quite good. The BBC international source is good, as others have mentioned. The Atlantic magazine has a terrific article by Ed Young, Y-O-N-G, that was published a couple of weeks ago about the whole history and evolution of the COVID-19 epidemic. The Washington Post is very good. And the New York Times science coverage is very good. However, I do caution about the New York Times. They sometimes tend to do he said, she said journalism, where they'll put out a false statement from a politician and then attempt to correct it from a reliable scientific source. So if you're reading he said, she said journalism, beware. You may be just spending a lot of time reading misinformation and then continuing in the story until you get the correct information. And I am concerned that some people may not be able to separate truth from fiction when reporting goes on like that. In other words, when journalists are reporting about COVID-19 as if it's a political game, those stories are not helpful for your understanding what is really happening on the medical and health front. So that's basically my take on things. As you can tell, I'm a real skeptic of information that comes from people who do not have a basis, factual, scientific basis for what they're promoting or saying.
Tom, thanks so much. I'm going to switch us over to gallery view now, and we're going to transition just a little bit over to answering some of the questions that came through from our registration page. If you are watching right now and would like to ask a question or still have questions for our panelists, feel free to use the chat box or the Q&A section here. One of the really fascinating questions that I got that I think touches on some stuff that a lot of folks in this panel have said. What would you say to folks who perhaps do not feel like they have the right scientific literacy to be able to parse what's going on in some of the very scientific language that you might read in a primary source? What are those people supposed to do? Tom, go.
Yeah, well, that is an issue if you don't have a scientific background. So I would pick a couple, not one, but a couple journalists who have a proven track record as science journalists. There's an association called the National Association of Science Writers. They put out excellent information for their members. And if somebody has been a full-time science journalist for a period of time, 5 or more years, writes for a reliable publication, those are people you can trust because they will go, one hopes, to primary sources to get their information, and they're very good fact checkers, and they're able to, as others have said, to contextualize stories so that you know the importance of a particular finding, importance of a new study that comes out that may have come to a conclusion about one small slice of the pie, but often you need to see the whole pie to know how significant a particular advance is in the medical world. And by the way, if you see the word hope, miracle, breakthrough, as it applies to almost any aspect of science, especially coronavirus, you can know right off the bat that that story is not a reliable story. That's promoting false hope. And that should be a key that any parent who's reading a story, hope, breakthrough, cure. There are very few cures in the last 50 years. Penicillin's one of them, but they're not a lot. And if there's a cure for coronavirus, a breakthrough in treatment for it, hope for a new treatment, all of those red flags.
I would also really recommend Medline Plus. It's a website that is from the U.S. National Library of Medicine, which is part of the NIH, and it does a really nice job translating health information for a lay public or a lay reader. If you really want something, really right on the health news, I can put a link to that in the chat. I think that can be a really great source for people who maybe don't feel like they have the scientific literacy to read those direct studies.
Awesome.
I'd like to add one thing to Tom's analogy of the pie, which I think was a great one. So I'm an NIH-funded scientist, and I do research as well. And I think another sort of thing to think about with respect to a pie is that, so there are pieces and contextualizing pieces from a single study, but often what we really rely on and what we need before we make really strong recommendations in many areas are many studies making up that pie, right? And so it can be very confusing when one study comes out and says this, and then the next week another study comes out and says this. And in the end, though, what scientists do is, really take a look at all of those studies overall and look at a wide range of factors. How rigorous were they done? How, what were the methods? What were the study designs? And then using all of those pieces of this larger pie to make really stronger recommendations.
And Sean, if I can add to that, if you have access to PubMed, P-U-B-M-E-D, you can search the medical literature, and there is a type of article in medical journals called a review article. And what a review article is exactly what Sean was talking about. Takes a mass of articles that have been written on a particular topic and makes sense of it, often in scientific terminology, but I think the lay reader may be able to get a lot out of that. Unfortunately for COVID-19, these review articles occur quite a bit after the fact. So it's too early in the pandemic to read a review article about pandemic treatments, especially, as I mentioned, a big clinical trial on hydroxychloroquine is just happening now. But if you want to read about any other disease entity, then a review article is a really good place to start.
Thanks, y'all. Mary, I'm aware that part of your job is also like kind of directly translating between extremely technical scientific language and then lay people who need to understand some of what's in those. Any advice for folks who might not feel like they have the right type of literacy here?
I liked Dr. Linden's, I'd had this in my notes too and hadn't mentioned it. I like Dr. Linden's comment about finding a reporter that you trust. And Anita, probably you do this too. I think there's some really good reporters who've been working for a long time in science and medicine, and they are going to always go, if you can last that long in the field, then you know who the reputable sources are. And I think they translate for you that hard science into understandable information.
Yeah, and if I could throw out a couple names, Carl Zimmer, New York Times, Donald McNeil Jr., the infectious diseases reporter for the New York Times is excellent. I mentioned earlier Ed Young, who wrote that Atlantic article that's gotten so much press over the last couple of weeks. So those are just three. I don't know if the National Association of Science Writers, if parts of their website are accessible to non-members, but if somebody is on the science beat, as Mary said, and has been doing it for a long time, that probably means they know what they're talking about, especially if they're working for a reputable publication.
Another good source that's really just coming into people's magnifying glass right now is STAT, and it's out of Boston, and they've lured some of the best science writers from other national publications up there, and they cover a lot of the bio if you're interested in pharmaceuticals and vaccines. I think they're doing a great job, some of their reporters interpreting hard science into lay-friendly information.
Thanks, y'all. Two more very broad sort of themes of questions that we got. One was, and I think some of y'all did a really good job of addressing this, how do I stop the spread of dis or misinformation within my community? And there was another really fascinating question along the lines of like, how do I talk to somebody who is doing that? I think that Megan, you did a really wonderful job of specifically doing that with teenagers, who I think are a particularly fascinating group to think about for this question. Any insight for folks with those questions?
Right. Well, we have questions raised all the time about people in our close spheres who are spreading things on Facebook, and we're not sure how to respond. I do know that some of the companies like Facebook and Twitter are trying to respond, and so they're including things that will pop up if you are trying to share something that has been deemed as fake or inaccurate. There's kind of a warning there, but I mean, I just think that we're all responsible. To me, media literacy as a skill is really important for our, as a society, as part of our civic engagement. And so if we begin to think about that as consumers and producers, we're bound to make sure that what we're sharing is as accurate as possible, and kind of going through those steps of judging for credibility. But it's difficult. And I think one of the things I also wanted to ask the other panelists about is that for me, a lot of the reporting I'm seeing are personal experiences of, for instance, patients. And so often it's not necessarily misinformation or fake, but one person's experience becomes generalized as the narrative about this virus. And so I'm just wondering if that's also kind of feeding into some of the complexities here for people as we're trying to navigate what we're seeing online.
Anita, I see you're unmuted. Any insight there?
I don't have a lot of insight in that particular question, but one thing I was thinking of as I was kind of preparing for this, I was reading a bit about how people's consumption of media has been changing in this time, and it's very generation dependent. People over the age of 55 are really mostly still listening to cable news. People under 20 are listening to a lot of podcasts. So I think that there's something to be said about finding ways to give people information in a format that they tend to go to, and making sure that if TV news is their preferred mode, having them tune to a channel, at least for some point of time, that's focusing much more on headlines than it is on talking heads. I think some of the challenges with some of TV news sometimes is that it's really, the programming lines are really blurred between things that are factual and things that are editorializing. And for an average consumer, you may not necessarily be able to tell that easily when someone is, an unbiased reporter versus a talking head, brought on to opine about one thing. So times of day, I mean, usually, honestly, like morning 8 to 9 time and 5 to 6 time, they tend to have less editorializing programming on most cable news. Tends to be a trend, but kind of look at like the streaming thing underneath people's name and see, to try to understand what kind of source they are. Also, terminology is a big part of a lot of COVID news stories that I think we need to be really careful about, because for a long time, now most people understand what flattening the curve is, and most people understand what social distancing is. But a lot of public health experts have said, until we get to a point where that's literacy known by 95% of people, we should be much more specific in our language. So when you're talking to younger people or talking to older people who maybe haven't been following the story as diligently, using language that's really specific, I think is important to kind of demystify what these bigger terms and trends are.
Tom, briefly, because we have one more question before closing remarks.
Just the point about a individual being the focus of a story. I interviewed Gina Colada, the medical reporter for the New York Times, for a book I wrote several years ago, and she talked about the tyranny of the anecdote. That is the beginning face of a story. That if the anecdote is so strong, it overwhelms the story, and you may get a false impression of the true meaning of a story. So beware of stories that focus on one person as if that person is the embodiment of the entire story.
That's great. I think there was a huge amount of people that asked the question that I think was really well addressed, which was, how much news should I be watching? Which is a really, really fantastic question that I think a lot of folks said in their remarks, please don't just sit in front of the TV all day, which is really, really good advice. The last question that I thought had not been sufficiently addressed so far was one around scientific uncertainty. And this is perhaps specifically a question for those of y'all on the panel who are currently practicing journalists, but also knowing that all of y'all are likely fielding questions from your own networks. How do you talk, what is there to report? How do you report on things when those things are not known perhaps by anybody? How do you report on something like ongoing uncertainty? It's a weird one. Anybody want to take a first crack?
I can take a crack at that. We sit down and have conversations with researchers and physicians. And I mean, I think this is where university medical school websites can come in, help and tell helpful stories, because we're telling stories. I mean, it may not be day of news, but it's something we've been, COVID's been here in the US for a few weeks now. And we're telling stories about how our communities feel or what our scientists are starting to work on. And the questions scientists are asking, are they the same questions the public is asking? And to me, that's always an interesting dynamic. Anyway, I don't know if that was helpful, but.
That is very helpful, Mary. Anybody else want to take a crack at that one? Tom, you've unmuted yourself.
Would you repeat the question again?
Sure. How do you report on uncertainty?
Oh, okay, yes. You basically report what you know, and if you don't know, then you say so. I think transparency is really, really important. And if you do your research as a reporter and you consult reliable sources and people say, whom you consult, that there is no reliable curative treatment for COVID-19, you say so in your story. And you don't necessarily even have to wait till somebody puts out a false message that there is a cure.
And I would just add to that, Max, like going back to my initial statement or my introduction is, for the public to really kind of check in with themselves as they're approaching reading the news. Are they seeking that certainty? Because if they are, they might be more likely to move from one to the next story until they find what they're looking for to confirm what they want to hear. So I think that's sort of a really simple practice that people can put into place in checking in with themselves before they embark on consuming all of this information.
That's great. This brings us to our last part of our panel, which is closing remarks. I'd love for us to keep these kind of brief, but I think that this is a really important piece. What closing piece of advice or guidance can you give folks that are watching this today? I'm just going to start with who is here first on my screen, and I'm going to start with Megan.
Yeah, so I think just protecting your mental health as well by choosing to unplug occasionally and trying to be as well educated and reading laterally in order to find credible sources.
Sean.
I've already given my summary statement just a second ago.
That's perfect. Mary.
I just wanted to go back to the parent perspective of this conversation and having kids. I think listen well. I think a lot of parents, and I'm guilty of this, you're telling your kids something, you're giving them facts, but more importantly, they're off consuming information, and let's listen to them and talk about what they're hearing and whether they believe what they're hearing, and maybe point them towards sources we've talked about today.
Awesome. Tom.
I think you have to accept that we're going to be living with uncertainty probably for the next year or two, because flattening the curve means that there's not going to be a spike in COVID-19 cases, but when you flatten the curve, that means the cases will continue to pop up over a longer period of time. So we have to live with uncertainty, and when we get very anxious, I think we need to go to reliable sources, and as others have said, and when we've consulted our sources, then unplug for a while, take a very long walk, it really clears your head.
Last but not least, Anita.
Yeah, I mean, I think while it is a global pandemic and a worldwide story, it's also really a community and a statewide and a regional story. And so kind of start where your feet are, read local news and think about the dynamics in your own community can be a way to start where you feel like you at least have a little bit more to grasp onto and a sense of your own place and purpose and way you can contribute in the face of all of this. So think local and act local.
I love it. And with that, that concludes our panel for today. Thank you so much for making some time to join us. Also, as I've said in the past couple of panels, thank you so much to the parents. We super duper appreciate your the tremendous responsibility that sort of has just been heaped on you right now, and appreciate not only your time in joining us for this panel, but for all of the tremendous and hard work that you are doing to make sure that all of us come out on the other side better. So thank you so much again, and that concludes our panel.
Thanks, guys.
Thank you, Bex.
Thank you.